Hi, everyone, and welcome back to English Unlocked, your friendly guide to learning English for everyday situations. I'm Emma.
And I'm Jake. Today we're talking about a very important topic: English in the medical field.
Right. Whether you're visiting a doctor, explaining your symptoms, or understanding medical instructions, knowing how to communicate clearly can make a huge difference.
Absolutely. We'll cover essential words, common phrases, and helpful tips for talking to a doctor or medical staff.
Let's start with some basic vocabulary you might hear or need to use at a doctor's office.
When you visit a doctor, they might ask about your symptoms. Symptoms are the signs that something is wrong with your body. These signs help the doctor understand what might be causing the problem. They can be things you feel inside your body, like pain or tiredness, or things that others can see, like a rash or swelling.
Right. For example, symptoms could be physical feelings like a headache, fever, cough, or stomach pain. Sometimes symptoms are things that others can notice, like a rash, redness, or swelling. It's important to describe your symptoms clearly so that the doctor can help you better.
Here are some common symptoms and how to say them clearly. Listen carefully and try to repeat after us to practice your pronunciation. Headache. I have a headache. This means your head hurts. You might also say, I have a dull headache if the pain is light, or I have a sharp headache if the pain is strong and sudden. If the pain is constant, you can say, I have a constant headache. If the pain comes and goes, you can say, I have an intermittent headache. If the pain is in one specific area, you might say, I have pain on the left side of my head. You could also describe the type of pain, like throbbing, which feels like a pulse, or pressing, which feels like pressure. Fever. I have a fever. This means your body temperature is higher than normal. You could also say, I feel very hot, which is another way to describe having a fever. If you want to be specific, you could say, I have a high fever if your temperature is very high, or I have a low fever if it is slightly elevated. If you feel cold and shiver, you could say, I have chills. If you feel warm but not very hot, you could say, I feel a little warm. Cough. I have a cough. This means you are coughing, which could be a sign of a cold or other illness. If your cough is dry, you can say, I have a dry cough. If you cough up mucus, you can say, I have a wet cough. You could also describe how often you cough by saying, I cough a lot, I cough sometimes, or I have been coughing all day. If your cough is very bad at night, you might say, I have a nighttime cough. If you feel pain when you cough, you could say, it hurts when I cough. Sore throat. My throat hurts. This means you feel pain or discomfort in your throat, especially when you swallow. You could also say, I have a sore throat. If it is very painful, you might say, I have a severe sore throat. If it feels dry, you could say, I have a dry throat. If your voice sounds rough or weak, you can say, I have a hoarse voice. If your throat feels swollen, you could say, my throat feels swollen. Stomach pain. I have stomach pain. This means your stomach hurts. If the pain is light, you can say, I have mild stomach pain. If the pain is very strong, you can say, I have severe stomach pain. You could also be more specific by saying, I have sharp stomach pain if the pain is sudden and sharp, or I have dull stomach pain if the pain is steady and mild. If the pain feels like squeezing, you could say, I have cramping in my stomach. If you feel pain after eating, you could say, I have stomach pain after I eat.
If you want to be more specific, you can describe how bad the symptom is. For example, I have a mild headache means the pain is not very strong. But if you say, I have a severe headache, it means the pain is very intense and may need urgent care.
You can also describe how long you have had the symptoms. For example, you could say, I have had a cough for 3 days, or my stomach has hurt since yesterday. This helps the doctor understand how serious the problem might be. If the symptom is new, you can say, This started today. If it has lasted for a while, you can say, I have had this for a week. You could also say, the pain is getting worse, or I feel better than before. If the symptoms come and go, you might say, the pain comes and goes.
Knowing how to clearly describe your symptoms is very important. It helps medical staff understand you quickly and give you the right treatment. So, practice these phrases until you feel comfortable using them.
When you arrive at a clinic or hospital, the receptionist might ask you some questions. For example, what is your name? Do you have an appointment? What is the reason for your visit?
Here's how you can answer. My name is Emma Smith. Yes, I have an appointment at 10 a.m. I am here because I have a bad cough.
Sometimes the receptionist may ask for other details. They could ask for your phone number, address, or health insurance information. Here are some more questions you might hear. Can I have your contact number? What is your date of birth? Do you have health insurance?
You can respond like this. My phone number is 555-123-4567. I was born on July 15th, 1990. Yes, I have health insurance. Here is my card.
Once you give this information, you may be asked to wait until the doctor is ready. When the doctor sees you, they will ask about your symptoms. You might hear questions like, what seems to be the problem? How long have you had these symptoms? Are you taking any medication? Do you have any allergies?
You could reply with, I have a stomach ache and it started 2 days ago. I feel very tired and dizzy. I am not taking any medicine. I am allergic to penicillin.
The doctor may also ask about your medical history or lifestyle. For example, have you had this problem before? Do you smoke or drink alcohol? Do you exercise regularly?
Here are some possible answers. Yes, I had a similar problem last year. No, I don't smoke, but I drink alcohol occasionally. I try to exercise 3 times a week.
If the doctor needs more information, they may ask for tests like a blood test or an X-ray. They might say, I would like to run some tests. We need to do a blood test to check for infection. I am going to prescribe some medicine for you.
If you do not understand something, you can ask the doctor to explain. For example, could you explain that again, please? What does that mean? Is this medicine safe to take with food?
Remember, it is okay to ask questions and share all your concerns with the doctor. This helps them take better care of you. After checking your symptoms, the doctor might give you instructions. It's important to understand these instructions clearly because they help you recover faster. Let's go over some common phrases you might hear during a doctor's visit. 1. Take this medicine twice a day. This means you should take the medicine 2 times each day. Usually, it's once in the morning and once at night. If you're unsure about the exact timing, you can always ask the doctor for more details. 2. Rest and drink plenty of water. This means you should take a break and avoid heavy activities. Drinking lots of water helps your body stay hydrated and can speed up your recovery. You might hear this if you have a cold, fever, or other common illnesses. 3. Come back if you don't feel better. If your symptoms do not improve, the doctor wants you to return for another checkup. This is important because some illnesses may need extra care or different treatment if they don't get better with the first medicine.
Sometimes medical instructions can be confusing, especially if the doctor speaks quickly or uses difficult words. If you don't understand something, it's okay to ask for clarification. Here are some useful questions you can ask. 1. Could you repeat that, please? If you didn't catch what the doctor said, this polite question asks them to say it again. You can use this phrase anytime you need the doctor to repeat information. 2. How many times should I take the medicine? If the doctor mentions a medicine, you need to know how often to take it. This question helps you confirm the correct dosage. You could also ask, should I take it before or after meals? To be even clearer. 3. Do I need to come back for another visit? This question is useful to know if you should return for a follow-up appointment. Some treatments require regular checkups to monitor your progress. especially for long-term conditions like diabetes or high blood pressure.
It's also helpful to know what to do in case of side effects. Sometimes, medicines can cause unwanted reactions. If you feel something unusual, you can ask, "What should I do if I have side effects? Is it normal to feel sleepy after taking this medicine?" If the instructions involve a specific action, like using an inhaler or applying a cream, you can ask, "Can you show me how to use this? How much should I apply each time?"
Remember, it's always better to ask questions than to be unsure. Doctors and nurses are there to help you, and clear communication is key to getting better. Don't be shy. Your health is important.
Absolutely. Understanding medical instructions clearly helps you take care of yourself properly. And if you ever forget something, you can always call the clinic or pharmacy and ask again. Now let's practice a conversation between a patient and a doctor.
I'll be the patient and you'll be the doctor. Ready?
Ready, let's go. Doctor. Good morning. What seems to be the problem today?
Patient. Good morning. I have a headache and a sore throat.
I see. How long have you had these symptoms?
About 3 days.
3 days. Do you have a fever?
Yes, I think so. I feel very hot and tired.
I understand. I will check your temperature. Please open your mouth.
Okay.
Your temperature is a bit high, around 38 degrees Celsius. That's a mild fever. Have you had any other symptoms?
Yes, I also feel very tired and my body aches a little.
I see. Have you taken any medicine so far?
I took some painkillers yesterday, but they didn't help much.
Okay. Do you have any allergies to medicine?
No, I don't have any allergies.
That's good to know. It sounds like you might have a mild infection, like a cold or flu. I will prescribe some medicine to help with your symptoms.
Thank you, doctor. How should I take the medicine?
Take 1 tablet twice a day after meals. It will help reduce the fever and ease the pain.
All right, is there anything else I should do?
Yes. Make sure to drink plenty of water and get enough rest. Avoid cold drinks and try to eat warm, soft food.
Okay, doctor. Do I need to come back for another checkup?
If you don't feel better in 3 to 4 days, please come back for a follow-up visit. Also, if your symptoms get worse, come back immediately.
I understand. Thank you for your help.
You're welcome. Take care of yourself and get well soon.
I will. Thank you, doctor.
Goodbye.
Goodbye.
Before we finish, here are some quick tips for using English at the doctor's office. Be clear and simple. Describe your symptoms clearly. For example, instead of saying, "I feel bad," you could say, "I have a sharp pain in my stomach." Be specific about when the symptoms started and how severe they are. If the pain comes and goes, mention that too. Clear information helps doctors diagnose you faster. Ask if you don't understand. It's okay to ask questions. You can say, "Could you explain that again?" Or, "What does that mean?" Medical terms can be complicated, so don't hesitate to ask for clarification. You can also ask, "Can you speak more slowly, please?" if the doctor is speaking too quickly. Learn common medical phrases to feel more confident. Phrases like, "I have a fever," "I feel dizzy," or "I am allergic to," are useful. Knowing these phrases will help you communicate effectively in stressful situations. Other useful phrases include, "I need to make an appointment," "Where is the pharmacy?" and "I need a prescription."
And practice speaking. The more you practice, the easier it will be to talk to medical staff. Try role-playing with a friend or practicing in front of a mirror. This will help you feel more comfortable when you need to describe your symptoms. You can also listen to English medical dialogues online to become familiar with common conversations. Also, keep a list of important medical information. This includes any medications you are taking, allergies, and past medical conditions. You can show this list to the doctor if needed. It's also helpful to note emergency contacts and your blood type, especially if you are traveling.
Another helpful tip is to listen carefully to the doctor's instructions. If you are unsure about how to take your medicine, you can ask, "How many times a day should I take this?" Or, "Are there any side effects?" You can also ask, "Should I take this with food?" Or, "What should I do if I miss a dose?" Understanding these details can prevent mistakes.
If you need urgent help, know how to describe an emergency. For example, you could say, I am having chest pain, I can't breathe, or I need help immediately. Being able to express urgent issues clearly can save time and even save lives. Finally, stay calm. It's normal to feel nervous, but taking a deep breath and speaking slowly will help you communicate better. Doctors are there to help you, so don't be afraid to speak up. If you're unsure about a diagnosis, you can ask for a second opinion by saying, Can I get a second opinion?
And remember, if you need to write things down, it's perfectly fine. Taking notes during your visit can help you remember important details later. That's it for today's episode. We hope you found this useful.
Don't forget to subscribe to English Unlocked and join us next time. See you soon and stay healthy.